Hello, I am Nurul Athar, PMP, CPHIMS and RTR certified, and welcome to my presentation on CPHIMS-CA exam prep domain Canadian healthcare system. Based on Canadian Supplemental Exam Handbook effective from May 2021, a candidate is required to study following topics under Canadian healthcare system. Demonstrate knowledge of health and health system in Canada and appropriately applies this information to work, products and service, including key characteristics, for example governance, funding, structures, agencies, related organization, emerging trend, etc. Determinant of health, for example environment, genetic, socioeconomic, and key factor of affecting healthcare, for example demographic and new technologies, incentives. Demonstrate knowledge of the way HI benefit are realized and measured in Canadian healthcare system. Demonstrates an understanding of different types of Canadian healthcare delivery models across the continuum of care and their interrelationship, for example hospitals, clinics, ambulatory centers and community health agencies, regional health authorities. Demonstrates knowledge of how people, resources and information flow through health systems. Applies knowledge of roles and relationship of health professionals along with organizational and regulatory structure in which they work. Address the challenges related to the adoption and realization of clinical value of information system in health sectors. Understand the need to balance the privacy of personal health information with improved care delivery and health system management. Promotes the safe and appropriate use of health information technologies to ensure patient safety. So let's start. CPHIMS-CA Canada domain Canadian healthcare systems. I have covered Canadian healthcare system under following titles. First, how is the delivery system organized and how are providers paid? What are the major strategies to ensure quality of care? What is being done to promote delivery system integration and care coordination? What is the status of electronic health record? Then we'll talk about digital health initiatives. What is interoperability, standards and innovative technologies, and then we'll talk about privacy and security. Canada has decentralized, universal, publicly funded health system called Canadian Medicare. Healthcare is funded and administered primarily by the country's 13 provinces and territories. Each has its own insurance plan and each receives cash assistance from the federal government on per capita basis. Benefits and delivery approaches are vary. All citizens and permanent residents, however, receive medically necessary hospital and physician services free at the point of use. To pay for excluded services including outpatient prescription drugs and dental care, provinces and territories provide some coverage for targeted group. In addition, about 2/3 of Canadians have private insurance. Now let's see how does universal healthcare coverage work. Canadian Medicare, Canada's universal publicly funded healthcare system, was established through federal legislation originally passed in 1975 and in 1966 Canada Health Act of 1984 replaces and consolidates the two previous acts and sets national standards for medically necessary hospitals, diagnostic and physician services. To able to receive full federal cash contribution for healthcare, each provincial and territorial health insurance plan needs to comply with the 5 pillars of Canada Health Act. Let's see what are 5 pillars of Canada Health Act. Number 1, publicly administered. Number 2, comprehensive in coverage condition. Number 3, universal. Number 4, portable across provinces. And number 5, accessible, for example, without user's fee. Now we'll see what is role of government. Canadian provincial and territorial government have primary responsibility for financing, organizing and delivering health services and supervising providers. The jurisdiction directly fund physician and drug programs and contract with delegated health authorities, either a single provincial authority or multiple sub-provincial regional authorities, to deliver hospital, community and long-term care as well as mental and public health services. The federal government co-finances provincial and territorial universal health insurance programs and administers a range of services for certain population, including eligible First Nations and Inuit peoples, members of Canadian Armed Forces, veteran, resettled refugees and some refugee claimants and inmates in federal penitentiaries. It also regulates the safety and efficacy of medical devices, pharmaceuticals and natural health products, fund health research and some information technology systems, and administers several public health functions on national scale. At national level, a variety of government agencies oversees a specific function. First we'll see Health Canada, which is Federal Ministry of Health, plays a key regulatory role in food and drug safety, medical device and technology review, and upholding of national standards for universal health coverage. Next we'll see Public Health Agency of Canada. It is responsible for public health emergency preparedness and responses, infectious and chronic disease and control and prevention and health promotion. A new federal government department, Indigenous Services Canada, fund certain health services for First Nation and Inuit. Most providers are self-governing under provincial and territorial law. They are registered with the provincial regulatory bodies such as the College of Physicians and Surgeons that ensures that education, training and quality of care standards are met. Most provinces have an ombudsperson who advocate on behalf of patients. Now we'll see role of public health insurance. The public sector and private sector accounted for approximately 70% and 30% of total health expenditures, respectively. Each PNT stands for Provincial and Territorial Health Insurance Plan, covers all medically necessary hospital and physician services on a prepaid basis. Supplementary services are those not covered under Canadian Medicare or largely privately financed, either from patient out-of-pocket payments or through employer-based or private insurance. Provinces and territories cover all of their own residents in accordance with their respective residency requirements. Temporary legal visitors, undocumented immigrants, visitors who stay in Canada beyond the duration of legal permit, and those who enter the country illegally are not covered by any federal, provincial or territorial program. Provinces and territories provide limited emergency services to these populations. No physician or hospital can refuse to provide care in an emergency, and midwives provide some maternity services. The main funding source is general PNT government revenue. Remember, PNT stands for provincial and territorial. Most provincial and territorial revenue come from taxation. Now we'll see role of private health insurance. Private insurance held by about two-thirds of Canadians covers services excluded under universal health coverage such as vision and dental care, outpatient prescription drugs, rehabilitation services and private hospital rooms. The majority of the insurers are for profit. Now we'll see services covered. To qualify for federal financial contribution, provincial and territorial insurance plan must provide first dollar coverage of medically necessary physician, diagnostic and hospital services including inpatient prescription drugs for all eligible resident. All P&T government also provide public health and prevention services including immunization as a part of their public programs. Now see cost sharing and out-of-pocket spending. There are no cost sharing for publicly insured physician, diagnostic and hospital services. Physicians are not allowed to charge patients price above the negotiated fee schedule. Now see safety nets. To help cover needed prescriptions, provinces and territories provide outpatient drugs plans to some individuals lacking private employer-sponsored insurance. Most P&T outpatient drug plans operate as a payers of last resort, targeting people on social assistance or of retirement age. These plans vary considerably. For instance, Quebec administered universal drug plan by mandating that eligible individuals have private coverage and enrolls those not eligible for private coverage in the public plan. In contrast, Ontario, Canada's most populous province, administers universal prescription drug program for seniors, children and youth without private coverage and recipients of social assistance. Okay, that brings us to end of this presentation. In next part, we are going to explore how is the delivery system organized and how are providers paid. I hope you would have found this information useful. If you like my videos, please subscribe to my channel and don't forget to press bell icon button so that when I upload new videos, you'll get notification. Thanks for watching. Bye bye.